Well, hospital wards in Afghanistan are filling up with COVID-19 patients that staff cannot treat amid a lack of medical supplies and money to pay medics' salaries. The contract between government and with a Netherlands-based aid organization to run the hospital has now expired in November.
At Kabul's Afghan-Japan Communicable Disease Hospital, the diesel fuel needed to produce oxygen for coronavirus patients has run out, and the hospital is now out of dozens of essential drugs. Many staff are struggling to make ends meet, but still turn up for work even if they have not been paid for months. This hospital is the only COVID-19 facility for the Afghan capital's more than 4 million people. The Afghan-Japan hospital's predicament is a symptom of the crisis in Afghanistan's healthcare system, which is teetering on the brink of collapse and able to function only with a lifeline from aid organizations.
مشکلات خودت دی مریضانو به حد لود زیاد دی چون اقتصادی وضعیت خراب دی شخصي روغتون ته ډیر نه زی د دوا فیصدي به کمه ده موږ امکانات هیڅ نه لرو کوم ایمرجنسي ته ضرورت هیڅ نه لرو د پرسونل فشار پرسونل باندې به حد زیات ده پرسونل اقتصادي مشکلات سره مواجه دي خو بیا هم همدغه ارزه خدمات ارزه تکیف مریضان ته خو مریضان لوټ نسبت نور شفخانو ته د ساتفل د ایمرجنسي وارد بيخي زیات دي.
Supply of oxygen is a big issue for the hospital for the treatment of coronavirus patients. And now they don't have diesel fuel to run their generators because the hospital's production plant hasn't worked in months.
We have in each bed center supply, but the center supply is off because of leakage of fuel. So we connect the patient to the cylinder.
The government is contracted with a Netherlands-based aid organization. But now the contract has expired in November, and the World Bank, like much of the international community, has frozen $1 billion of Afghanistan's assets stored abroad. Dr. Ahmad Fatah Habibiyar, the hospital's logistics manager, said that salaries had gone unpaid for over 3 months and that there were shortages of equipment, drugs, and food. Dr. Ahmad Fatah said some staff were in such severe financial straits that they have had to sell their household furniture to make ends meet.
Even since more than 3 months, we didn't pay any of our salaries. We don't have any medical equipment, necessary equipment, necessary medicines for COVID that have approved for WHO. We don't have that. We don't have enough equipment, foods, oxygen supply, fuels, everything is going to be finished.
Last year, almost half the population in Afghanistan was living in poverty, with the situation exacerbated by the coronavirus pandemic and a drought that has driven up food prices. The new Taliban government is urging the international community to ease sanctions and release Afghanistan's assets abroad so it can pay civil servants, including doctors and teachers.